Hello friends, today I have recorded one more lecture of gross anatomy, that is thyroid gland. To make most out of this lecture, you need to view this video carefully, and whenever there are draw and learn sessions, you have to draw along with me step by step so that it will be your revision as well as practice. Hello friends, today we will discuss one of the important endocrine gland, thyroid gland. The thyroid gland name, it is derived from the word thyros, which means it is a shield-like structure. You can see in the slide that a picture of shield has been pasted over there. It is largest endocrine gland and it secretes the hormone T3, T4 and calcitonin. There are different functions attributed to the thyroid gland like maintenance of basal metabolic rate. Then through the hormone calcitonin, it regulates the calcium metabolism and it is responsible for psychosomatic growth. Special features of thyroid gland: it is a unique gland because it is the only endocrine gland which is situated in a superficial position. So it is located in the neck and it is easily palpable. Another unique feature is it uses iodine as a raw material for the synthesis of the T3, T4 hormones. Next, it is unique in its own way because it stores the hormone before its release. So these are some unique features of thyroid gland. And lastly, as it is an endocrine gland, it will be having a rich blood supply. A rich vascularity is the unique feature. So before studying any topic, we should divide it under various subheadings. If we know the subheadings, it will be easy for us to remember the topic in the exam. So we will have to divide this topic under the various subheadings like location, its parts and external features, weight and dimension, capsule of the thyroid gland. We have to give emphasis on because it is a very important question from the exam point of view. We have to compare it with the prostate gland. Then we have important relations. These are also called as important neurovascular relations of the thyroid gland. Then we will discuss arterial supply and venous drainage, lymphatic drainage, nerve supply and applied aspects. Let us discuss the location. It is located in the midline part of the neck anteriorly. It is situated or it is clasped around the trachea. The vertebral level of thyroid gland, it is from C5 to T1 vertebrae, C5, C6, C7 and T1 vertebrae. So this is the vertebral level, and we have to keep in mind a common mistake that the students tend to make, that writing the position of the thyroid gland over the thyroid cartilage. So it is a very common mistake. So one should not make this mistake, and you have to remember that thyroid gland, it is situated in front of the trachea and not over the thyroid cartilage. However, its apex, it reaches up to the oblique lamina of the thyroid cartilage. About the parts and features, it is H-shaped gland or butterfly-shaped gland. It is having two lobes, right and left lobe. These are called as lateral lobes, which are connected by a middle isthmus. And sometimes there is a pyramidal lobe. It may arise from the isthmus. It is a small extension from the isthmus, and this small extension, it is connected to the hyoid bone with the help of a fibromuscular band which is called as levator glanduli thyroidi. So this may be asked as a multiple choice question: levator glanduli thyroidi and pyramidal lobe. Now let us discuss the extent of the lateral lobes. Each lateral lobe superiorly it extends up to the oblique line on the thyroid cartilage, and below it extends up to the fifth or sixth tracheal ring. Extent of the isthmus. The isthmus it lies around the second, third and fourth tracheal ring. Each lobe it has apex, base, two borders, anterior and posterior border, and three surfaces. These are medial, lateral and posterolateral. So two borders, anterior and posterior, and three surfaces, medial, lateral and posterolateral, and it has got apex and base. Let us see how to draw this diagram showing the extent of the thyroid gland and various features, various external features. We will begin with drawing hyoid bone. Below the hyoid bone, we will draw thyroid cartilage. Below the thyroid cartilage, show the cricoid cartilage and the tracheal rings. Next, show the oblique lines on the thyroid laminae and draw the apices of the thyroid gland, base of the thyroid gland, and complete the other side structure also, which is connectmus. Now I am showing the pyramidal lobe. It is a small projection upwards from the isthmus, and next we will show the levator glanduli thyroidi connecting the pyramidal lobe to the hyoid bone. On one side we will show the vertebral extent, that is C5 to T1. Complete the labeling. Let us discuss the important part, that is capsule of the thyroid gland. It is very important because multiple times questions have been asked on this topic. So there are two capsules, inner true capsule and outer false capsule. True capsule is nothing but the condensation of the fibrous stroma, and false capsule it is derived from pretracheal layer of the deep cervical fascia of the neck. On the medial surface, on the medial surface of the lateral lobe, this particular pretracheal fascia it condenses to form ligament of Berry, and it connects the thyroid gland with the cricoid cartilage, and because of this attachment the thyroid gland it moves with the deglutition. So this pretracheal fascia, its condensation, it is attached to the hyoid bone, it is attached to the cricoid cartilage. That is why the swellings of the thyroid gland, these are easily distinguished from other swellings, because the thyroid swelling it moves with the deglutition. The thyroid gland capsule it is compared with the prostate gland capsule. In thyroid gland there is a venous plexus which is placed deep to the true capsule, whereas in prostate the venous plexus it is situated in between true capsule and false capsule. So this has got a surgical implication. So whenever we want to remove the thyroid gland it needs to be removed along with the true capsule to avoid the hemorrhage. So we remember this as thyroid is removed totally along with true capsule, whereas in case of prostate we have to keep the true capsule intact. So the prostate is enucleated, leaving behind the true capsule. So we remember it as prostate. In prostate gland the capsule is preserved, P for P. Now we will discuss the relations of thyroid gland. We begin with the apex. Apex it is related to the inferior constrictor muscle medially, which arises from cricoid as well as the thyroid cartilage, and laterally it is related to the sternothyroid muscle. So we can say the apex of the thyroid gland it is sandwiched between these two muscles, that is inferior constrictor and sternothyroid muscle. The medial surface relation, these are remembered as two tubes, two muscles and two cartilages. Trachea and esophagus are two tubes. Two muscles are inferior constrictor and cricothyroid, and two cartilages are thyroid and cricoid cartilages. So easy to remember medial surface relations: two tubes, two muscles, and two cartilages. Laterally, the lateral surface, it is related to the strap muscles of the neck. These are sternothyroid, sternohyoid, superior belly of omohyoid, and these three muscles are covered by a larger muscle, that is sternocleidomastoid, which is covered within the investing layer of deep cervical fascia. Posterolateral surface of thyroid gland, it is related to the carotid sheath along with its contents. The contents are internal carotid artery, internal jugular vein, and vagus nerve, anteriorly embedded ansa cervicalis, and posteriorly related sympathetic chain. Anterior border of the lateral lobes, these are related to the superior thyroid artery. The posterior border, it is related to the parathyroid gland, as well as the anastomosis between the posterior division of superior thyroid artery and inferior thyroid arteries. Let us discuss the relations of isthmus. Isthmus, it is quadrilateral. As we know, it has got two surfaces and two borders. The anterior surface of the isthmus, it is related to the strap muscles, that is sternohyoid and sternothyroid, and it is also related to the anterior jugular veins. Posterior surface, it is strapped to the second, third, and fourth tracheal rings. This we have already discussed. The superior border, it is related to the anastomosis between the anterior branches of the superior thyroid arteries, and the inferior border, it shows emergence of inferior thyroid vein, and when present, thyroidia ema artery enters at this border. Now we will see how to draw these relations. So this is the diagram to show the relations of the apex of thyroid gland. We will see how to draw this diagram. This is the schematic diagram to show the thyroid cartilage, cricoid cartilage, and the tracheal ring. From the thyroid cartilage and cricoid cartilage, show the origin of the inferior constrictor muscle. From the lamina of the thyroid cartilage, show the other muscle which is present laterally. It is sternothyroid. And now draw the apex of thyroid gland in between these two muscles. So this apex, it is also related to the external laryngeal nerve and superior thyroid artery, which is not shown in this diagram. Next, we will draw the other relations of thyroid gland. So in the next frames, we will see how to draw this diagram step by step. We will draw trachea, the central portion. Then we'll show esophagus posterior to it. Clasping the trachea, anterior to the trachea, we will draw thyroid gland, two lobes connected by the isthmus. As we have already discussed, the gland, it is surrounded by the pretracheal fascia. Let us draw the pretracheal fascia which envelops the thyroid gland. Along the posterolateral surface, we will show the parathyroid glands. Anteriorly, the relations of the lateral surface: sternothyroid, sternohyoid, and superior belly of omohyoid, which are covered by sternocleidomastoid muscle on both the sides. The sternocleidomastoid, it is enveloped by investing layer of deep cervical fascia. So we will draw it, investing layer of deep cervical fascia. We will show the recurrent laryngeal nerve in between trachea and esophagus. Posterolateral surface, it is related to the carotid sheath and the structures within it. We have already discussed: internal carotid artery, internal jugular vein, and vagus nerve. Posteriorly, we will complete the diagram after drawing the prevertebral fascia and vertebra. Next, we will discuss blood supply of the thyroid gland, mainly the arterial supply. First, we will enumerate the arteries. The arteries supplying are superior thyroid artery, inferior thyroid artery, thyroidia ema artery, and accessory thyroid arteries. Superior thyroid artery, it is a branch of external carotid artery, whereas inferior thyroid artery, it is a branch from the thyrocervical trunk, which arises from the first part of the subclavian artery. Thyroidia ema artery is not always present, but whenever it is present, it arises from brachiocephalic trunk or arch of aorta. This is the diagram showing blood supply of the thyroid gland. So we will learn how to draw this diagram, and we will also revise the blood supply and the neurovascular relations on this diagram. So let us first draw the thyroid gland, two lobes and isthmus. Begin with arch of aorta. Show the branches on the left side, that is left common carotid and left subclavian branch. Right side show brachiocephalic trunk, which give rise to the right common carotid and right subclavian. The common carotid further divides into internal carotid and external carotid. From the external carotid, show the superior thyroid artery, which runs along the anterior border and superior border of the isthmus and anastomose with the branch on the other side. The posterior division runs along the posterior border to anastomose with the inferior thyroid artery, which will arise from the thyrocervical trunk, which is the branch of subclavian artery. This is thyrocervical trunk and the inferior thyroid artery. Now draw the vagus nerve and show its branches, that is superior laryngeal nerve, which will further divide into external laryngeal nerve, which accompanies the superior thyroid artery, and the recurrent laryngeal nerve, which winds around the subclavian artery, which accompanies the inferior thyroid artery. Next, show the thyroidia ema artery arising from the brachiocephalic trunk or the arch of aorta. Let us discuss the neurovascular relations of the thyroid gland. At the apex of the thyroid gland, there is external laryngeal nerve and superior thyroid artery. These are together, but these are away from each other near the apex. At the base, the two structures are recurrent laryngeal nerve and inferior thyroid artery. These are closer to each other near the base as shown in the diagram. Let us understand this through drawing the diagram. We have drawn the thyroid gland. In a simplified way, show the apex and base, and I have shown the superior thyroid artery along with the external laryngeal nerve. At the apex, I have shown them apart from each other, and the superior thyroid artery, it should be ligated near the apex, whereas at the base I have shown the inferior thyroid artery and recurrent laryngeal nerve. They are moving closer to each other near the base, so the inferior thyroid artery, it should be ligated away from the base. So I hope the neurovascular relations are clear now. Let's understand this one more time. This is the thyroid gland. Show the apex and base. At the apex, show superior thyroid artery and external laryngeal nerve. So they are moving away from each other as they approach the apex. So to avoid injury to the nerve, we have to ligate the artery nearer to the apex. Whereas at the base, the nerve and vessel, that is recurrent laryngeal nerve and inferior thyroid artery, they move closer to each other as they approach toward the base. So to avoid injury to the nerve, the artery should be ligated as possible as away from the base. This is the venous drainage of the thyroid gland. So we are having two arteries, constant arteries, superior thyroid artery and inferior thyroid artery, but we are having three constant veins, that is superior thyroid vein, middle thyroid vein and inferior thyroid vein. Occasional artery present is thyroidia ema artery, and occasional vein present is Cocker's vein. Let us learn how to draw this diagram. Begin with drawing the thyroid gland. Show the superior thyroid vein emerging at the apex, then superior thyroid vein emerging at the apex, then middle thyroid vein, and emerging from the isthmus show inferior thyroid vein. The superior and middle thyroid vein, they drain towards the internal jugular vein, whereas inferior thyroid vein, it drains to the left brachiocephalic vein. So let us show these veins, internal jugular and left brachiocephalic vein. So this is very important. In the exam, you may get this question. Inferior thyroid vein drain towards, it is left brachiocephalic vein, and whenever present, the additional veins, the veins of Cocker, they drain towards the internal jugular vein. Now let us discuss the lymphatic drainage of thyroid gland. The upper part of the thyroid gland, it drains towards prelaryngeal and jugulodigastric or upper deep group of the cervical lymph nodes. The lower part of the thyroid gland, it drains towards pretracheal and lower deep cervical group of lymph nodes, which are also known as jugulo-omohyoid. The isthmus part, it will drain towards the retrosternal nodes, or we can say these are brachiocephalic nodes. So let us learn how to draw this lymphatic drainage. So begin with drawing thyroid gland. On one side, show internal jugular vein. Crossing it, show the posterior belly of digastric and superior belly of omohyoid. Now draw the lymph nodes. In the upper part, it is the jugulodigastric lymph nodes, and in the lower part, it is the jugulo-omohyoid lymph nodes. Now show the pre-laryngeal lymph nodes, and in the lower part, show the pretracheal lymph nodes, and draw the retrosternal lymph nodes and show the lymphatic drainage to the respective lymph group of lymph nodes as we have discussed. Nerve supply of the thyroid gland, it is sympathetic as well as parasympathetic. The sympathetic fibers, these are mainly derived from middle cervical ganglion, and they may come from superior as well as the inferior cervical ganglion. Parasympathetic fibers, they are derived from vagus nerve and its branch, that is recurrent laryngeal nerve. Now let us discuss few important points about the applied anatomy. First one is goiter. Goiter, it is the enlargement of thyroid gland, and remember, it may be due to hypothyroidism or hyperthyroidism. In both the cases, the thyroid gland, it may enlarge. So in which direction the gland may enlarge particularly? So it will not be enlarging towards the apex, because at the apex it is arrested by the sternothyroid muscles and the muscle that is attached to the thyroid lamina. We know it is sandwiched in between the inferior constrictor and sternothyroid muscle. So these muscles, they will prevent upward movement, as well as the gland, it will more grow on the posterior aspect, because posteriorly the capsule of the thyroid gland, it is slightly thin as compared to the anterior border. So posteriorly it will enlarge, as well as in the downward direction it will enlarge. What are the effects of the enlargement of the thyroid gland? So if we remember the relations of the thyroid gland, then it is easy for us to remember the effects of the thyroid gland. Pressure on the two tubes, the pressure on the trachea, it will cause the dyspnea, difficulty in breathing, whereas pressure on esophagus, it will lead to difficulty in swallowing the food. It is called as dysphagia. And pressure on the recurrent laryngeal nerve, it will lead to hoarseness of voice or difficulty in speech production. It is called as dysphonia. So these are known as 3Ds of the thyroid gland enlargement side effects. Further, we can add to our note the removal of the thyroid gland, which is known as thyroidectomy. Then we can comment on thyroglossal cyst. So if thyroglossal duct it persists, it will lead to formation of a retention cyst, which is called as thyroglossal cyst. And sometimes the thyroid tissue it is present at ectopic sites. So these ectopic thyroids are present in lingual, that is, and on the posterior aspect of the tongue, then suprahyoid and infrahyoid positions, above the hyoid and below the hyoid. So these are called as ectopic thyroids. I hope this session was fruitful and you will be able to write a long answer question on the thyroid gland gross anatomy. Soon I will upload a video of histology of thyroid gland as well as the development of the thyroid gland. Thank you very much. So friends, I hope you have watched this video and I think it was useful. I hope you have practiced all the diagrams that I have drawn in this session. For more such videos, please subscribe my YouTube channel and share with your friends, like this video and leave your useful feedback in the comment section. Thank you very much. See you.